Discover the subtle signs your body may be whispering. Explore the crossroads of lifestyle choices and learn how you can steer your health in a positive direction. To help us understand more about pre-diabetes and diabetes in general, joining us live, we have Dr. Daveric Pagsisihan, Internal Medicine of Endocrinology. Welcome to It's a Beautiful Doc. Thank you so much for coming, and thank you for waking up early.
Hello, good morning. It's a beautiful day, Miss Monique.
Good morning. So, Doc, I didn't realize until moving here to the Philippines that diabetes is so prominent with Filipinos. Why
Yes.
is that?
Right now, about 8% of adult Filipinos have diabetes. And one of the main reasons here is the increasing urbanization of our country. Of course, our culture, the way we eat, the food that we like, and of course, some genetic problems that we also have. Some genes that we get to pass to our siblings. So those are the main reasons why there is an increasing number of people with diabetes in the country.
Doc, can you tell us what are the common signs or symptoms that indicate that a person may have diabetes?
Now, the problem with diabetes, most patients would have no symptoms at all. So don't feel anything unless their blood sugars are really very high, such as in the 300s or 400s. That's when they feel that they urinate more, they feel thirsty most of the time, they wanted to eat more, and some of them will even lose more weight even if their diet or if their appetite is really good. So the problem is wala talagang masyadong symptoms.
Well, you mentioned, Doc, that wala talaga masyadong symptoms, but then let's say for someone who's a bit younger and doesn't realize na may symptoms sila, what words could you say to someone who should get checked, or at least someone who should check out whether or not they are either a diabetic or they could be at risk of being one?
Well, in the Philippines, we recommend that all adults who are at least 40 years old should at least check their blood sugar once a year. So that's by doing fasting blood sugar. But if you have a family history and you are a little bit overweight, then we recommend it to do it younger, probably whatever age you have. Just do a fasting blood sugar once a year and then have it checked by your endocrinologist or any doctor.
Doc, what are some lifestyle changes we can do if ever we are pre-diabetic or we're just wanting to not be diabetic?
Not get close to it.
Yeah, because it's scary.
Yan, medyo easier said than done, di ba?
Oo.
Yung diet and exercise, because of course, we Filipinos would really love to eat, no, together with their family. So, bawas lang ng konti. That's the first advice that I usually give my patients. Bawas lang ng konti. Try to eat less carbs. Choose food that are high in fiber and less in carbohydrates. And of course, exercise. The recommended exercise would be at least 30 minutes
Yeah.
of moderate exercise at least 5 times a week.
5 times a week yung sa
Yes.
exercise
Yes,
for 30
5
minutes.
times a week,
Mahirap
Cal.
nga yan, Doc. But all joking aside, Doc, you mentioned it a while ago that it's a bit part of yung kultura ng Pilipino. The reason why there is a high rate of diabetes here in the country. What are the siguro unpopular pieces of advice that people should consider with regards to at least yung culture natin or what we typically do as Filipinos to prevent diabetes?
Yeah. When I teach my patients about diabetes, I tell them yung mga common myths about diabetes like eating a lot of kamote or ngayon kasi yung mga saging na saba and all the herbal plants that they usually take
Yeah.
to decrease their blood sugars. Actually, they are really not validated by any scientific studies. So what I usually teach is try to avoid, let's say, starchy vegetables, less of those. Eat a lot of non-starchy vegetables. You can shift your, let's say, yung rice to higher fiber type of rice like brown rice, and eat protein in moderation and fats.
Doc, I'm curious, is there a specific age where diabetes normally shows up? I know you mentioned earlier the test when you're 40, but if you're pre-diabetic, like when you're 20, but is there a specific age where we should really be worried?
Before, according to our National Nutrition and Health Survey, the prevalence of diabetes or the number of people with diabetes starts to increase at the age of 40, 40 to 50 and 50 to 60. So that's why the recommendation to start screening at the age of 40. But right now, we are actually seeing a lot of patients less than 40 years old. So we have 20 years olds and 30 years olds. They are being diagnosed because of increasing testing during their pre-employment examination sa companies nila. So we get to catch them earlier. So that's why kahit nga hindi ka 40, if you have family history or you're overweight, it's recommended to have your self-check kahit wala kang symptoms.
And if you catch diabetes early on, is it preventative or do you still have diabetes? It's just easier to manage.
Yeah, if you're already diagnosed with diabetes, it tends to be a lifetime condition. But for patients with early onset diabetes, it can be easily managed with lifestyle therapy. Some patients can be controlled with just healthy diet kasi hindi naman nila alam before. And now they know it already, so they'll be more conscious about the food that they eat. But there are some people with very high blood sugar, so we can't do anything about it. We have to give medications, be it in a tablet or insulin or combination. But the baseline for all patients, dapat lifestyle therapy. So that's diet, exercise, and losing a little bit of your weight. It's better to lose at least 5 to 10% of your baseline weight. So that will already improve the metabolic profile of your body.
Napa-math kami doon, Doc. As soon as you said 5 to 10% of our weight. But then, sorry, before I throw it back to Anne over here, Doc, you mentioned a while ago na you're seeing more people or younger people catching that they are pre-diabetic due to yung mga physical exams, especially due to pre-employment. But would you say that the average age of diabetics are getting younger in the Philippines? Or is it just because we are seeing more screening that we're actually just catching more people rather than seeing a rise due to an overall lifestyle or cultural shift?
I think it's both. Because there's a change in our lifestyle now, we tend to, di ba, yung mga pagkain, it's madali na siyang orderin. It's just a text away. So, and then yung mga pwedeng i-offer na pagkain in the restaurants, di ba, mas dumadami siya. And of course, the early screening at a younger age also contributes to that increasing prevalence. So, our society, the Philippine College of Endocrinology, Diabetes and Metabolism, is on the works on the new clinical practice guidelines on diabetes. So I think that the age for screening will be lowered from 40 to probably around 35, but I do not want to preempt yet because it's not yet finished.
You know, Doc, actually, there's a rise in childhood diabetes. You now see kids having diabetes already, di ba? What's your advice, to the parents or our viewers right now? Ano pwede nilang gawin to manage childhood diabetes in their kids?
Yeah, the parents kasi will play a vital role in management of nutrition among kids. So, syempre, kung ano yung kinakain ng parents, malamang yun din yung kakainin ng mga anak nila, no? So, I always tell the parents my patients that they should always monitor their children's weight.
Yeah.
It has to be within the normal growth curve or normal weight curve for age. And that is being checked by the pediatricians every once in a while during their checkups.
Doc, we're going to have to wrap things up in just a bit, but then for those who want to follow you, get more advice from you online, and maybe have a consult with you, how can they reach out to you?
I'm really very active in our society. I actually head the Advocacy Council of the Philippine College of Endocrinology, Diabetes and Metabolism. So you could follow us on our website, our Facebook page, that's PCEDM Incorporated, our Instagram, X, and TikTok, that's PCDM_PH. I also have my own TikTok and social media accounts. Just look for Daveric Pagsisihan. And I have a clinic in Cavite, so it's very far from most people. So, but they can seek consult to any endocrinologist near their area.
Well, of course, for those in the South, not too far away, Doc. Maraming salamat, Doc. We hope to be able to talk to you again really soon.
Thank you.
All right, that was Dr. Daveric Pagsisihan. And of course, you can reach out to him in the social media accounts that he mentioned a while ago.